Having a problem. I need help. It's okay to say those things when it's related to a patient, but if it's related to you, well, I'm sorry, work is not the time and place for you. Work is for the time and place for patients. And the problem is that we can't disconnect from our own humanity. And this just keeps digging and digging and digging. So the next thing that we need to talk about, because when we have all this anxiety and we have all this depression and it's not dealt with and we just keep going and going, it's what happens with burnout? And the worst extension of that is suicide. And this is a problem that is rampant in healthcare. I can tell you personally, we have three physicians, all surgeons, who have died by suicide in this last year in my home city. And that's just me in my little world, and it's all over. And the problem is that everyone's starting to talk about it and like, oh, we're going to do all these burnout things. The problem is that when you hear, well, you just need to meditate more, take a hot bath, do yoga, go for a walk. You know what? All of those things are great and they are great stress reducers and they help manage you. But the problem is we're not dealing with any of the causes and the sources of this. And so right now, there's no solution to my problem. And so if I meditate more, I can't really meditate because I'm so upset about whatever, taking the hot bath, it doesn't make it any different that all of these other stressors are still present. And there's no one who is really actively working on trying to fix that. And so the problem is that this continues and this continues. None of our stressors are going away. We're not changing necessarily our exposure to them. We're not dealing with them in any particular way, perhaps. And maybe, perhaps now there's a new layer, and maybe there's an issue with our family. And maybe it's a marital issue. Maybe there's a divorce. Maybe there is a separation. Maybe there's a problem with one of your kids. Maybe they're ill, maybe they have their own struggles. Maybe you have so much extra responsibility that that doesn't fit into your current work schedule and the demands that you have. The problem is that our family is our foundation. And so whatever is going on in our work, as long as our foundation is stable, we've got a good shot, right? At really doing a good job at really taking care of ourselves in some possible way. But when it hits you so deep in your core, you can't really disconnect from that. And then when you connect into everything all at once, it just becomes overwhelming. And the pain that you can possibly experience is deafening. And it's unsurmountable in your own mind. And so you're like, well, why is suicide a good idea? Well, it's a perfect idea, right? Because we have become black and white, all or nothing kind of people. And so this is going to stop the pain immediately. And I just can't go on for one more minute. And the problem is that we are tired and we're tired physically. Maybe we've been up for a 24-hour shift, maybe 48 hours. There's still some physicians who are taking 48-hour call, which still boggles my mind that that is even legal. And we need our medical societies to do something about that. But nonetheless, you're up, you're fatigued. Maybe you've done your 24-hour shift and you are sick and no one is sending you home because you're on call. You've got to be the one that's taking care of people. And so you are physically tired, you're physically sick, and you're emotionally just at your last, you know, at your wit's end. You can't go any further. And this, it just makes so much sense, even though it makes no sense at all. When you have sleep, you've eaten, you've had an emotional kind of purging of all this difficult stuff. And when you do that regularly, it keeps you healthy as a human being. But when that's not happening regularly, this is a real problem for us. And so we've taken this all or nothing in the hero approach to practicing medicine, but it also becomes our Achilles and can take us down. And I really feel like we have to work on that.